It's a too familiar scene, a mass casualty event. People hurt and bleeding. And for some, every minute counts towards saving their lives.
In the trauma world, 40% of our patients die from exsanguination, and that's a fancy word for blood loss. 40% is huge. Too many people are dying. A lot of these people die before EMS ever get there or before they ever make it to the trauma center.
Spartanburg Regional Healthcare System has implemented a life-saving program to prevent trauma victims from bleeding out.
So Stop the Bleed program is a very important program, and it's quite simple. It's exactly what it says. You want to stop the bleed. We teach it to anybody. I've taught it to high school students, high school teachers, church groups, anywhere in the community.
A badly wounded person can bleed out in as little as 3 to 5 minutes, roughly just a half gallon of blood loss. By offering these Stop the Bleed kits to schools and other organizations across the upstate, it's hoped lives will be saved when there are only minutes to stop the bleeding.
We know that a lot of these people, they truly need help before EMS get there. We call them first responders, but even on the best day, it takes a few minutes, right? It takes them some time to get to the scene. So it's my job and it's our job to train these community members, we call them civilian respondents, to find the bleed and stop it.
The kits include the vital tools needed to help a badly wounded person, to give these people a better chance of survival, and to give them time to make it to the hospital, and anyone can be trained to use them.
This is an example of a particular bleeding control kit. We want these kits anywhere people congregate. You can put them in your car, you can put them in a purse, but when you open them up, you have a couple of things, right? First thing, here, we have some packing. Some of these packings have different things in them to help your blood clot faster. Some of them may not. It just depends on the particular kit that you get. So, you're gonna open it, and you can see it here. See how it comes out? When it comes to packing a wound, a lot of people just wanna put it on top and hold. That is not the correct way to do it. What you wanna do is take your packing, you're gonna open that wound, and you want to literally, just like it says, pack the wound. You can take the rest of it, pop it on top, 2 hands, and you would be wearing gloves if at all possible. Push down with both hands and hold. And you're gonna wanna hold this until help arrives. This is the tourniquet that one would use in an emergency situation. You wanna unravel it. Once it's unraveled, this is a cat tourniquet, right? So you need to create your hole. It's gonna go 2 to 3 inches above the wound. And obviously we can see where our wound is. This is gonna tighten back onto itself. This is Velcro, so it's very easy to do. Then, over here you have a C-clamp. You turn it, and the key word is until the bleeding stops. Really, it's anybody who has 2 hands. You can do it with 1, it's easier with 2, but if you have this, you can find the bleed and stop it. It's anybody who is willing to step up and save a life.
Simple techniques, essential to saving lives, offered by Spartanburg Regional Healthcare System.